Thank you for joining and for taking the time. I'm Julie Havlack with the North Carolina State Health Plan, and I am joined by North Carolina State Treasurer Dale Falwell and Dr. G. Bai from Johns Hopkins Bloomberg School of Public Health. We're here today to talk about hospital charity care. The Treasurer and the State Health Plan invited researchers from Johns Hopkins Bloomberg School of Public Health to investigate hospitals' charity care spending. For background, as I'm sure you all know, charity care is free or discounted care provided to low-income patients. So that is not Medicaid or Medicare underpayments. That is free care to patients who couldn't otherwise afford it. It's widely considered to be one of the most important category in hospitals' community benefits. Hospitals get lucrative tax exemptions worth millions of dollars in exchange for providing these community benefits, especially charity care. Those tax exemptions are worth about 5.9% of total expenses, or millions of dollars. Our research shows that for our largest systems, across those largest systems, that's about an estimated $1.8 billion in tax breaks. That's $1.8 billion. Our research also shows that only about 25 of our 100 plus nonprofits outspend our tax breaks with charity care. And with that quick summary, I'm going to turn it over to the Treasurer for remarks. If you have any questions, please just message me with chat box and I will unmute you or call on you and you can unmute yourself. That's just, I think, will help keep us a little bit more in the rails. All right, Treasurer, thank you.
Thank you, Julie, and thank you, Dr. and Johns Hopkins. We have enjoyed our partnership, and the purpose of this is to talk about North Carolina's nonprofit hospitals failing in providing charity care despite the tax breaks. You know that we've been on a crusade for the last 3 years to try to rein in the spending for our state health plan cost. And this is one of the issues that we're looking at in addition to many other issues. The fact is that just the state health plan is on an unsustainable course as far as healthcare costs going up at a much faster pace than the appropriations into the state health plan. This charity care issue that we've partnered with Johns Hopkins with, we need, going forward, we need auditable and accountable benchmarks for charitable care spending. And this becomes a bigger issue because of what we're seeing in this particular area where it's profits over patients. And that's not something that any of us should be in favor of. We know that like in any situation, there's obviously opportunities for more oversight. But the fact is that we have seen the cartelization of healthcare in North Carolina over the last 4 years. The definition of that in the Webster's Dictionary is an association which is formed to restrict competition and or raise prices. This is happening in the West, it's happening in the East, and it's happening in the central part of our state. So with that, we appreciate all of your interest in this very important topic. There are going to be other very important topics coming out regarding healthcare and its impact on lower and fixed income people of this state. And with that, I'll hand the meeting over to Dr. from Johns Hopkins. And thank you for joining us.
Thank you so much, Chair Falwell. My name is Ji Bai. I'm a professor of accounting at Johns Hopkins Carey Business School. I'm also a professor at Johns Hopkins Bloomberg School of Health as a professor at the Department of Health Policy and Management. So my research expertise is in the intersection of healthcare pricing, management, and policy. So it's really my great pleasure to be here today to meet all of you. Thank you very much, Shara, for having me. So hospital profitability has been increasing steadily in recent years, nationwide as well as in North Carolina. Why? Because hospitals are getting higher and higher prices from privately insured patients. And many very profitable hospitals in the nation, as well as in North Carolina, are actually nonprofit hospitals. The nonprofit hospitals do not mean they don't make money. Actually, many of them are very profitable. They are called nonprofit because they have this tax exempt status, right? And then they receive tens and billions of tax exemption each year. So these hospitals do not pay federal taxes, state taxes, and local property taxes. Also, the tax exemption enables nonprofit hospitals to receive tax-deductible contributions from donors and issue tax-exempt bonds, which reduce these hospitals' borrowing cost. So these exemptions subsidized by taxpayers' money is largely intended to subsidize the cost of charity care. Charity care is provided to the financially disadvantaged patients without expectation to get paid. So the hospitals do have discretion to determine who is eligible for charity care and how easily the patients can access to the charity care policy information from the hospital. So as this report demonstrates, many profitable nonprofit hospitals in North Carolina actually did not provide much charity care. So the provision of charity care do not appear to justify these nonprofit hospitals' tax exemption status, right? In other words, some nonprofit hospitals might not behave in accordance with their charitable mission. Then the question is, why should the taxpayers continue to subsidize these nonprofit hospitals? And then why should local communities be deprived, right, of their property tax revenues and other tax revenues that would allow them to fund local schools, parks, and other public services, right? So these are important questions that I believe every taxpayer and the public should be concerned about. Yeah. Thank you very much.
Thank you, Dr. Jibai and State Treasurer. I'm going to open it up for questions. Please message me if you have any questions in the chat box on the side. I'm sending out a message now so that you can sort of see that it's there. And I will unmute you and introduce you. Or you can just unmute yourself and I'll call on you. Thank you so much. That's just throwing a message in the chat box. Thanks, everyone. Hi, Dana. Thank you so much. This is Dana Irving. Please unmute yourself and ask your question. Oh, sorry, Dana, we can't hear you. Would you mind unmuting? Give me 1 sec. I'm trying to unmute you on my end. She did. Hi, Dana. Sorry, we're having some technological issues. Just give me 1 second to make sure that you can unmute yourself, because you should be able to on our device. Hi, Dana. Would you just mind typing the question in the chat and I'll ask it to the treasurer while I try to figure out these mute settings? Thank you. Sorry about that. All right, everyone. Would you mind? Perfect. Dana wants to know which hospitals are the worst offenders in giving charity care. Jibai, would you mind taking this, or I can answer?
So if there's many different ways to look at that question, right? So one way is look at the actual number provided by at the end of the report, look at the comparison between the charity care provision and the total expenses. Another way to look at it would be to compare not only the charity care provision in relation to the expense, but also look at the profitability. Because the tax exemption status means that the hospitals must justify, right, to provide charity care within their financial viability. So if a hospital make a lot of money, but then provide disproportionately low charity care, especially given that the hospital does have discretion, then that raises a red flag. Thank you.
Thank you. And Rose Hoban with a North Carolina NC Health News is asking if you can give us some idea of the breakdowns in the data, where are these charity care expenditures coming from, the 990s or other sources? Jibai, would you mind taking that one, or I can?
Sure. So, some of my colleagues, we got to the cost report. This actually is not from the 990 form. There are two issues in 990 form. The one is the overall the charity care is only reported at the organizational level. So let's say a hospital system has several hospitals affiliated, but on the 990 form, you only can see the organization as one unit, right? You don't know exactly how much charity care is provided by the individual hospitals. But on the cost report, which is a mandatory filing by all the Medicare certified hospitals to the CMS, Center for Medicare and Medicaid Services. In that report, we have all the charity care information, and it's reported consistently across hospitals. So the second benefit of that cost report is that the charity care is reported both for the insured patients and uninsured patients, which is a feature that is not available in the 990 form. Thank you.
Perfect. And Gary Robinson would like to know if you could please define Medicaid and Medicare underpayments and why that is important to this discussion. Jibai, would you mind taking that?
Sure. So the charity care is defined. It's not just defined, in this report, but also look at the previous publication and also the government. When they report, there's a report requirement. It's clearly defined as the financial assistance to patients without expectation to get paid. So there's a voluntary component in charity care. In contrast, if you look at the so-called underpayment of Medicare or Medicaid, which is defined as the difference between the cost of providing the care from the hospital and the actual payment received. So there's no passive component into it. So traditionally, and if you look at everywhere, all kind of report, charity care is clearly differentiated from the underpayment for Medicare or for other public programs like children's program, etc.
Perfect. Thank you, G. And there's one more component to Gary's question, and then we will catch up to Port City Daily. Sorry for keeping you waiting. Treasurer, would you mind taking this one? Gary would like to know why this report is important to the state health plan members and their dependents.
Thank you. The reason, Gary, that this is important to the state health plan and its dependents is that we are on an unsustainable path in terms of the cash flow of the state health plan. And this issue about charity care is one of the things that have been brought up to us by hospital executives as to why they cannot get rid of secret contracts, why they're unwilling to push the power down to the consumer, and why they continue to actually boycott their largest customer, which are those that teach, protect, and otherwise serve. So, and I would just add to that at the end of the day, this is all about not only transparency in healthcare, but transparency about what the true definition of this charitable care is. Because as you know, these entities do not pay sales tax, do not pay income tax, and do not pay property tax. And this is, as was mentioned just a moment ago by the doctor from Johns Hopkins, this puts an additional burden on local governments, and not just the strong local governments as we've seen in the recent census, but especially on the arms, the legs, the toes, and the fingers of our state, which is rural North Carolina.
Thank you.
Thank you, Treasurer. And we're going to catch up to Port City Daily, which messaged a while ago, and they just messaged the question. Joanna would like to know, aside from bloated executive compensation, what are hospitals doing with their excess profits and reserves? They may claim that they need these funds to finance major needed capital projects. That's open to either Jibai or the Treasurer.
I'll start by saying that what needs to happen is the cartelization of healthcare in North Carolina needs to stop because the consumers are not being protected. This is especially hurtful to lower and fixed income individuals of our state. And the stopping the cartelization means the stopping of the borrowing, stopping of the buying, and stopping of the building. Those three B's are things that are going on across North Carolina. And it's all complicated by something that is best pronounced as a CON. It's obviously stands for Certificate of Need. But when you have a cartel that can restrict the supply of something and charge anything they want to for people who don't want to consume the product because they'd rather not be sick, when they're asked about what this product may cost, they're looked at as if they have three eyes. And then when they were not told what it cost and they get a bill in the mail, they don't pay, then their credit gets destroyed. Imagine a product that you don't want to consume, they won't tell you what it cost, and then when you don't pay for something you didn't want to consume and weren't told what it cost, then your credit's destroyed. This is very impactful, especially to our lower and fixed income people across North Carolina, especially in rural North Carolina.
Hi, G. Anything you'd like to add to that? The question was, aside from bloated executive compensation, what are hospitals doing with those excess profits and reserves?
Yeah, right. So that the excess profit can go into the reserve. Reserve simply is the difference between hospitals' assets and liabilities, and the hospitals can have, in theory, unlimited amount in their reserve, and there's really no any regulatory or legislative guideline requirement in terms of how much hospitals can put in their reserve, both for for-profit and nonprofit. So especially in nonprofit situation, there's really no shareholders, right? In for-profit, you have the shareholders owning the hospital, but in nonprofit situation, there's really no shareholders. So there are many stakeholders. So in that case, the reserve accumulates, eventually in theory has to be contributed back to society, contributed back to stakeholders, which include the taxpayers.
I would like to add to what the doctor just said, that in one particular case, Atrium Health has over $7 billion in the bank. If you look at their profit and loss, what you'll determine is that these entities are as much investment firms and real estate development firms as they are providers of healthcare. And let's be very clear on this call. We're not talking about the people who actually do the work of healthcare. We're talking about the multi-million-dollar executives who run these multi-billion-dollar nonprofits. And it's just important to realize that when we use $7 billion in one particular instance of a nonprofit's reserves, we're not talking about a company that makes software or sells widgets. All of that profit was made on the back of a sick person, every piece of it. And to put that in context, $7 billion in reserve is nearly twice as much as the long-term debt of the state of North Carolina. That's how absolutely significant this is.
Thank you, Treasurer. And we're going to catch up with Adam Owens with WRIL. He would like to know what time frame the study covers and whether the pandemic circumstances could explain these issues. G. Bai, would you mind answering the question? And if Treasurer you have any comments, please jump in.
So it is too early to get the financial information from the pandemic era. So this is 2019. 2019 is before the pandemic kicked in. But if we look at the recent reports regarding the for-profit hospital chains, we can get some sense of what the pandemic has brought to hospitals. The dip in profitability is only temporary, and then most hospitals have recovered and even accumulated a lot of profits as the pandemic keeps fading now. Thank you.
I would add to that the issues about how the pandemic has affected this particular subject. I think that when all the information is determined months from now, you'll be looking at even less charity care and possibly even higher profits during this period of time.
Thank you, Treasurer. And Michael Hyland would like to know, to what extent would expanding Medicaid in North Carolina reduce the need for hospitals to provide charity care? Treasurer, would you mind taking this one?
As Michael and others on this call know, the subject of expanding Medicaid is something that is on the yoga mat of the General Assembly and the governor, and it's been on their mat for a long period of time. I have not read the report yet, but Michael, I would refer you to Politico, who just put out a report recently that showed that in states where Medicaid was expanded, the profit of nonprofit hospitals exploded while the charity care went down. You'll have to verify that by reading that report in Politico, and the doctor may have some comments on that. But expanding Medicaid is a battle between the General Assembly and the governor. You know, Medicaid expansion is about access. And what we're trying to do at the state health plan is to make sure those that teach, those that protect, and those that otherwise serve have access. And one way that we do that is by providing a family premium such that many of our public servants don't have to work 1 week per month just to pay the family premium associated with the largest purchaser of health care in North Carolina. And anyone who continues to be on the side of secret contracts and these other issues that we're talking about ultimately is going to be on the wrong side of history. And it's not just me saying that, it's Bill Gates saying that, it's Warren Buffett saying that, it's Senator Elizabeth Warren saying that, it's the previous president as well as the current president who are trying to bring transparency to healthcare. All these issues about people's credit being destroyed, consumers not being protected, people not being accountable and audible about the number of amount of charity care they do. It all goes into the fact that we have 20% of our citizens' income going toward something they don't understand. And I will say this as somebody with an accounting background, these entities who report to only make 1 or 2% profit, but yet people will come in and pay billions of dollars for an entity that only makes 1 or 2% profit, defies common sense.
Thank you, Treasurer. Michael, I will make sure to send you that investigation from Politico once we get off the call. We're going to move on to Colin Campbell's question for Treasurer Falwell. What policy changes would you propose as a result of these findings? And do you think the legislature should limit which hospitals qualify for nonprofit status?
What I would propose is something that I've talked about for a number of years, even before I was the state treasurer in North Carolina, and that is we need solid, accountable, and audible benchmarks for what the definitions of charitable care is, so that the average person can figure out whether these entities are actually earning the right to continue to be nonprofit entities. Number one. The second thing is, as I've said before, we need to focus on we need to focus on transparent health care. It would be an economic gold rush for North Carolina if we were known as the state with transparent health care, a simple economic gold rush. And the fact is that we have enough needs, and we have enough money, and we have enough brains. We should be able to figure this out. But the cartelization of healthcare, the concentration of power in the hands of fewer multi-million-dollar executives who run these multi-billion-dollar nonprofits is something that can no longer continue, because the consumers of this state have not, will not, and will never be protected as long as this occurs.
Thank you, Treasurer. And we've also got, moving on to Teresa from the Carolina Journal. She says, I think it was asked, but not sure it was answered, which hospitals are at the top of the list for being the worst offenders? G-Bai, would you like to take this one, or should I?
Yes, please.
Perfect. Okay, so if you look at the appendix at the back of the report, it's going to organize the hospitals for you in terms of charity care as a percent of expenses, from those that are devoting the least amount of resources to those that are devoting the most amount of resources. You can also compare it by profit. It's a little tricky to decide who is the worst, because do you measure charity care against profit in sense of who has the resources to spend more on charity care? If you look at the profit, if you compare the profit, we have 15 hospitals that all make margins over 20%. Only 4 of those 15 hospitals delivered enough charity care to exceed the value of their tax exemption. Again, the tax exemption is about 5.9 of total expenses. So you can flip through the pages. It depends on how you want to define worst, I suppose. That's a bit of a complicated answer. But please feel free. And then also Guy Lucas has a question about page 4 of the report. The map graphic, yes, you're right, Guy. The colors got mixed up in a last minute graphic change. I'll make sure to update that and then send an updated version of the report. is fewer than 25 hospitals exceeding the value of their charity care. I'll make sure to switch that for you. Sorry about the confusion. And then Adam Owens with WRIL has another question. Where is the study posted? Adam, I will send that to you right after. It's at the bottom of the media advisory, but it will also be attached in the press release that we release out. Rose Hoban, same thing. Yeah, it's at the bottom of the media advisory. Sorry, guys, that wasn't clear enough. And then Rose Hoban would like to know who paid for this analysis. Treasurer, you can take that one. No one paid for it. Johns Hopkins provided the data when we asked them for it. And
we thank Johns Hopkins for doing this.
Thank you very much. Yeah, so we are a university, and we do this research among our faculty members and our students. But we are sponsored by a Arnold Ventures, to study healthcare pricing, especially in the private sector, to help state understand the pricing mechanisms, and think about what kind of policy angles are there can address those high price in the commercial market.
Excellent, thank you. And for the appendix, D, if you look at the hospital system name, under where the hospital system would be, it's just going to say for-profit in the appendix. Those are the ones that are for-profit. It's worth noting, maybe G-Bai would like to comment on this, that nonprofit hospitals are not the only ones who provide charity care spending. G, would you mind just sort of diving into that briefly?
Thank you. Actually, that is a main finding from our published study on health affairs. Many for-profit hospitals provide a lot of charity care. If you look at the nation overall, actually the for-profit ones in aggregation provide actually more charity care than nonprofit hospitals in terms of their relationship to the total expense. So in other words, it is not clear if we just look at the comparison between nonprofit and the for-profit hospitals in their charity care to expense ratio. It's not clear why the nonprofit hospitals receive so much subsidy and at the same time provide less than for-profit hospitals for charity care.
Excellent. And then Rose has a follow-up. She would like to know what kind of taxes these hospitals are exempted from. In other words, sales taxes, property taxes are the obvious tax breaks, but what are some of the less obvious tax breaks?
Well, income tax, property tax, sales tax. And if you think about how that impacts local school districts, you can see why this is so important. I would also say that many of these entities are the largest users of zoning in their communities. I don't know what subsidization they may receive, but they're the largest users of water and sewer, for which they do pay for. They're probably the largest users of landfill space. So these are some of the little tangential things, but the big ones to focus on are sales tax, property tax, and income tax. And I want to remind all the people who are Zooming in today that these big nonprofits get a sales tax refund, but the local school districts of North Carolina do not. I repeat that. The local school systems of North Carolina do not receive a sales tax refund, but these big multi-billion-dollar nonprofit hospitals do. Does that make any sense to anyone on this call?
G, is there anything you'd like to add on that point for some of the less obvious tax breaks?
Yes, and I would also add in our published articles, we also mentioned the two benefits that's not directly for tax exemption, but related to the financial benefit hospitals received. Number one is the tax exempt bonds. So the hospitals can issue the bonds, which will receive a much lower rate than a for-profit hospital. So that will reduce the cost of borrowing, right? Indirectly benefiting the hospital. Then number two is the nonprofit hospitals also receive a lot of charitable contributions from donors. Let's say, right, someone want to donate money to the hospital to maybe support some kind of research, or just to have some grant there. So those fundings only go to nonprofit hospitals because the donors believe that the nonprofit hospitals are pursuing charitable mission. Usually the money does not go to for-profit ones. So those two contributions as well as the tax exempt bonds are additional benefits that nonprofit hospitals receive. Thank you.
Thank you. And going back to one of the earlier questions about some of the worst offenders, just because I feel like we didn't fully answer that, if you go to page 6 of the report, we have analysis of charity care and a tax exemption by our largest hospital systems. If you take a look at that graphic, it's going to break down the worth of their tax exemption, how much they're spending on charity care, how much they're holding in capital assets, including property, and how much they have in the bank in unrestricted reserves. That is all drawn from Emma, the tax bond data. So feel free to take a look at page 6 of the report if you need to. And
hey, Julie, can I interrupt?
Sure, please.
Thank you. Just to put a bow on what was just said, it's very clear that the Zoomers need to know that part of the 21 major duties and responsibilities of the state treasurer is to chair the local government commission. So when the doctor talked about these financings, these tax-free financings, these are things that come through the local government commission, which also falls under the purview of the state treasurer's office. I also want to say, because I saw another question in there, to put some of this in context about the spend and the number of people in the state health plan. The state health plan has nearly 750,000 participants. To put that in context, that is almost equal to the domestic employment base of Warren Buffett's Berkshire Hathaway, Jamie Dimon's JP Morgan, and Jeff Bezos' Amazon. If you put all those companies together, their domestic employment base is only slightly larger than the buying power of the state health plan. There should be no excuse, given the fact that we are the largest customers of all these entities, that we should not be getting higher quality, higher access, and lower cost. We're spending about $3 billion a year gross for healthcare and pharmaceutical benefits on behalf of those that teach, protect, and serve.
Thank you, Treasurer. And then Joanna would also like to know how large is the state health plan, how many people, and how much is paid to every year to Blue Cross Blue Shield.
Yeah, I just answered that. And Blue Cross Blue Shield, to be clear, is our third-party administrator. We are self-insured. In addition, because we've been talking about money and balance sheets and income statements here, let's be absolutely clear that North Carolina, when I was sworn in, I inherited a $34 billion unfunded healthcare liability. Because promises were made for people to be eligible for health care after 5 years and 1 day of vesting for decades. People were eligible for lifetime health care after 5 years and 1 day of service, but no money was ever put aside for that purpose. That's why this PAYGO model, in addition to the fact that healthcare costs are going up tremendously, is the reason why all of these subjects are so vitally important to the real health and well-being of our state.
Thank you, Treasurer. And Joanna would also like to know a follow-up question. How does a hospital not get reimbursed by Medicaid and Medicare? Can you talk us through some examples? Joanna, it sounds like you're talking about when hospitals claim underpayments by Medicare and Medicaid. Jibai, would you mind talking through this one? And then Treasurer, would you add any comments? Thank you.
Thank you, Julie. A hospital does get reimbursed by Medicare and Medicaid. The problem here is some hospitals have a high cost for treating patients. So hospitals count the difference between the cost of treating patients and the payment received from those public programs as underpayment. It's not like they don't get paid, it's just the payment is lower than the hospital's own cost. So that each individual hospital would have so-called underpayment from Medicare or Medicaid programs. This is very different from charity care, which is voluntarily provided, voluntarily determined by the hospital based on the patient's, in theory, based on the patient's financial situation, and unilaterally provided without, any ask from the patients. So I give you the charity care, you don't need to pay. It's this difference between the payment rate and hospital's cost.
Treasurer, do you have anything to add?
I do not have anything to add.
Perfect. Are there any other questions? I'm not seeing any in the chat box, but please message me if there are. I'll give it about a minute.
I just want to close by thanking all of you for participating in this, and especially John Hopkins and all the work that they've done to partner with us. I also want to remind you that even though there's lots of different folks from different media outlets here, the News and Observer, McClatchy, Charlotte, in combination with Raleigh, did a story about the power of these cartels nearly 8 years ago that they were nominated for a Pulitzer for. And so anyone who wants to see what was reported on this topic 8 years ago, you can go and dig up that fantastic series. And I will just tell you, after reading that, you need to realize that this problem has gotten exponentially worse since that series was done by News and Observer and the Charlotte Observer.
Thank you. We have one last question from Rose, and then we're just going to do the treasurer's last closing remarks. She says, how are hospital building programs related to the charity care issue? I think she's talking about the value of their property, land, equipment that we break out. Treasurer, would you mind taking that one?
I'll develop a little better answer on that. I can just tell you that when you have a limited supply associated with the CON, otherwise known as certificate of need, when you have limited supply and you have only the power concentrated in the hands of fewer people, and they build, they borrow, and they buy, they consolidate even more, and that's to the detriment of people who have to pay for this product that they'd rather not consume, and they don't know what it costs.
All right, thank you everyone so much for joining. Treasurer, do you have any closing remarks?
Thank you for putting this together. This is the beginning of a lot of series of issues that we're going to be doing on this. And as I said earlier, this is really happening. Every one of your listeners, every one of your readers, every one of your viewers know that something is wrong with healthcare. Everyone. And on behalf of those that teach, protect, and otherwise serve, we're trying to figure out what's right, get it right, and keep it right for the financial solvency of our state health plan. Thank you. And Doctor?
Thank you so much, Chair, and thank you everyone for your time and attention to this important question. As taxpayers, I do believe taxpayers and the public do have the right to know, as the Chair said, the transparency issue, and also have to request and demand the accountability from nonprofit hospitals, right? These hospitals do receive substantial tax subsidies from the public. So in return, they should contribute back. So that's really something I think the public and the taxpayers should consider and should think about how to improve the current situation. Thank you, Chair. Thank you, everyone.
Thank you, and stay tuned.